Hello everybody, good afternoon. Welcome all of you to this sixth session of PCM. Am I audible? Okay. So we will begin with the prayers, and I am offering my respectful gratitude to Dr. Khemka sir and his team. So the treatise 3, in that yesterday we had already covered almost 6 chapters, and today we will be beginning with this 7th chapter, page number 51. Organ degeneration vessel or parenchymal and epithelial degeneration or OR meridian. Okay, I will share some screen here. This is organ degeneration vessel or the parenchymal and epithelial degeneration, OR meridian. So the screen is visible to all of you. So the location, we will see the location of this meridian. It starts from the right side of ring finger and goes back to the palm. Right side of the ring finger, radial side. This is ring finger, its radial side means on this side towards the thumb. I can show you through this also. Is this visible to you? And this is ring finger, it's a radial side, this side. Is this screen is visible? Hello?
Yes, sir, visible.
Yeah, this hand is visible to you?
No, sir.
No, sir.
Oh. Only screen is visible, no?
Yes, sir.
Yeah.
Okay, wait a minute. Okay, Now it's visible.
Yes, sir.
So actually I have this model with me. So I just want to show you. This is hand model. This is the nail side. This is the dorsal side of the hand. And this is the ring finger. Towards the thumb. Here is the beginning. This meridians, OR meridian starts from here and goes towards the dorsal aspect of the hand. Okay. Okay. So this it has 11 points. This bilateral meridian and specifications. They have mentioned what it treats. It treats cellular degeneration due to the faulty spinal innervation, that is autonomic instability. Organ degeneration, any organ degeneration. Degeneration, how it happens? It happens when the age advances. Because of the age, because of the influence of the time, every organ or every part of the body may become dwindled. Dwindling happens. These are the stage in our life. You might heard in the Ayurvedic acupressure about the 6 stages of our life. This is birth, old age, disease, death. In before death, old age. In old age, there is a dwindling. Dwindling means degenerations of almost all body parts. So degeneration. Then organ degeneration vessel treats parenchymal and epithelial degenerations. These are the types of the cells. Parenchyma. Parenchyma is the capsule or the covering of any internal organs. Covering of any internal organs. That is parenchyma. And epithelial degeneration. It treats the degenerative changes in the whole of the peritoneum. Again, peritoneum is also the covering. Then malignancies and prospective or future malignancies. It is also treatable by this meridian. Then deep limb system of the body. This is also called as the deep limb system. Then malignancies and conditions like neoplasia. This can be treated with this meridian. Then they have mentioned the CMP. This meridian is having only one CMP, one control measurement point, that is OR1B, for organ degeneration of all the organs in the body. Okay. Now, what is parenchymal degeneration? Parenchyma is the functional element or essential element of an organ as against its stroma or framework. In the last 2-3 lines it has given, see, protective layer is known as the parenchymal layer or capsule of the organ. Correct? Degeneration of this layer or capsule of the organ is known as the parenchymal degeneration. It is covering any organ. On the next page, 52, what is epithelial degeneration? In the hollow organs, which blood vessels, gastrointestinal tract, heart, urinary bladder, uterus, vagina, ureters, urethra, etc. The luminal surface is again protected by single or more layer of cells, and that is epithelial cells. This deep layer is known as the epithelial or endothelial. Endothelium. Degeneration of this deep layer is known as the epithelial degeneration. All blood vessels, every organs, the deep layer is called as the endothelium or epithelium layer, which degenerates and which can be treated by this meridian. This meridian treats the following diseases: chronic osteomyelitis. What is this osteomyelitis? It's a degenerative disease of bones covering of the bone and bone. Osteomyelitis. Empyema, then Hodgkin's disease, multiple myelomatosis, tuberculosis, rheumatoid arthritis. In rheumatoid arthritis also there is a degeneration of the two bones are connected to each other in any joint, correct? Like this. So both the surfaces of the bones becomes degenerated in the rheumatoid arthritis also. Then a theorem, degeneration of blood vessels. Atheromatosis, it is called as atheromatosis, atheroma. Degeneration of blood vessels, mainly arteries. Less production of erythrocytes and leukocytes. Then ninth is stopping of impulse, degeneration of liquid in nerves in the region for this. Because degeneration happens in the nerves, that's a stopping of the impulse. Impulse is not going properly forward or not coming backward like that. Lipoidal degeneration of glomerulars in kidney reduces the formation of urine in this filtration rate decreases. So kidneys degeneration. Then degeneration in tubules of the nephrons, again kidneys. Then in osteoarthritis, that means in the joints. Degeneration in cartilages of the points of bone reduces the repairing capacity of the cartilages. So the movement get impaired. And this disease mainly appears in the cervical spine or basal joints of the thumb and hip joints. Okay, rheumatoid arthritis. Then albuminous degeneration of the kidney, liver, and heart. Then lipoidal degeneration of the gallbladder, heart, kidney, brain, and thyroid glands. Hydropic degeneration of kidney, liver, and heart. Like that, all over in the body, all organs get degenerated according to the time or any infective changes, like that. Malignancies, so many malignancies has given. Scleroderma. Okay. Now we will see on the page number 54. It's proper point-wise locations and indications of this meridian. OR meridian. Okay, OR1. This is MP for parenchymal degenerative changes of all organs in the abdomen and pelvis. See, abdomen and pelvis, OR1. This point is here on this side, OR1 first, on this side. Okay. So this is OR1. Treat chronic constipation, OR1 and OR1B. See, for chronic constipation, it is a very common problem nowadays, chronic constipation. So in case of constipations, you can treat these both the points, OR1 and OR1B.
Sir,
Yeah.
so this OR1 is on the yin-yang border, is it? Is it so?
But OR?
OR1 is on the yin-yang border, is it?
Yeah, it's border only. Border means we have already seen every finger has 3 digits, 3 phalanges.
Right.
Upper phalange, middle phalange, and lower phalange.
That's
So
right.
upper phalanges, concave part of the upper phalange has 1 point of every meridian.
Which, okay, it looks as if it's below the nail. That's why I was wondering how to identify it.
No, it's not below of the knee. Nail part is just above. Nail is upside, but the point is on the lateral aspect of the finger. Lateral aspect means, see, this is my finger now inside towards the thumb. So in the length of the nail, at the center of the nail, length of the nail, there is that point on the lateral aspect, means on this towards the thumb. You can just press your finger so you can feel the bone's concavity. So point should be not on the nail, but it is in the diagram, it is looking just below the nail.
Right.
But it is on the lateral aspect, means towards the thumb. This side.
This side, right?
Yes.
Am I showing it right?
Yes. You are showing it correctly.
Okay. Thank you, sir.
Sir, it should be sedate or tone while constipation?
No, in degeneration, almost all the points should be sedated. And in constipation, also sedation.
So can we use star magnets instead?
Yeah, that is very best option. No use of our thoughts like no sedation or no tonification. Use methi strip also. Methi, the seed of the methi. And star magnet is okay, no problem. So treat this point for cancer of organ of a stomach and abdomen. Why it is mentioned any pelvic organ and abdominal organ? Anything is there. So the large part is covered by the large intestine. So constipation is treated with these points, 2 points, OR1 and OR1B. It is very effective. Then OR1-1, lymphatic burdening from cellular degeneration or organ degeneration. These points tells about the degree of degeneration and the amount of its impact on lymphatic system. Okay, OR1A, it's a measurement point for organ degeneration due to autonomic instability, that is due to faulty spinal innervation, where the spinal innervation is not properly, means nerve supply is not proper to any organ. That time this can be treated. Treatment on this point cures the problems of autonomic steering. Correct, means its functions gets activated. If any organ's functions are not properly happened due to not proper supply of the nerves, then after applying this point, the functions of that particular organs can be started. As autonomic steering happens. Then OR1B, it's a CMP for organ degeneration of entire organ system, excluding endocrine glands and mammary glands. Okay, excluding, not including. Endocrine gland and mammary gland is not treatable with this point. Okay. Then OR1C, CMP, you know, CMP control measurement point, where it is? It's a middle phalanx and below part, means towards the hand. Correct, correct. Yes, Priya Iyer, ma'am. Perfect. Now OR1C, MP for degenerative changes in the whole of the peritoneum. Peritoneum anywhere. Okay. This point can cure ulcer and malignant ulcers also when any organ gets misplaced from its original place in abdomen. Okay, that is given about the peritoneum. Okay, you can see the diagram given on page number 55. Okay, then on next page 56, OR1D, it's MP for degenerative changes in the whole of the pleura. See, pleura is, what is meant by pleura?
Covering of lungs.
Correct, covering of the lung. So this OR1D is specifically acting on the pleura, degenerative changes of the pleura. Treat this point for TB of lungs, infection and cancer of the lungs, etc. Okay. Then OR2, MP for degeneration of organs of the chest and neck. Any organ of chest and neck, OR2. Then OR3, MP for parenchymal epithelial degeneration process in organs of the head. You might be knowing that the principle of this, using this first, second and third point of any meridian in this electro acupuncture by Dr. Voll. First point is for what? First point should be used for
Lower part of the
Lower
body.
abdomen, yeah. Lower part.
part of the body. Then second point is for upper
Middle.
part of the body. Yeah, means upper part of the body. And the third point is for
Head and
Head and neck.
correct, perfect. So OR4, MP for degeneration of the abdomen and pelvis. For finger amputees, treat this point. Okay. Then OR5, MP for degeneration of organs in chest and neck. Use this point for finger amputees. Yeah, it is mentioned about the amputation cases. OR6, MP for degeneration of organs in head. Then special note is given in organ degeneration, advised to eat vitamin A. A means any actually A, D, E, K. All the 4 vitamins can be advised. A, D, E, K. Leafy vegetables, carrots, and some fruits like. Okay. Then we will go to the next chapter. This is 8. Joints and articular degeneration vessel, JD meridian. Page number 57. So this meridian starts from the tibial side of the second toe's nail, goes to dorsum of foot. Okay, I am having this model also. I can show you here. See, this is the foot. Okay. So this is dorsal aspect of the foot. So second toe is just near to this thumb. Just near to thumb is second toe. And this is tibial side. Where is tibia now located? It's the medial aspect or lateral aspect. Do you know what is meant by medial and lateral?
Medial.
Center. Lateral.
Center of the body.
Yes, perfect. Center of the body is medial and lateral means outside.
Towards side. Yes.
So outside is a fibula bone in the leg, and medial means center of the body. Towards medial side is the tibia bone. Correct? Tibia.
Tibia.
So this meridian, JD, joint meridian, joint and articular degeneration meridian, starts from the tibial side of the second toenail. So you can see in the diagram here also on page number 60, it is given towards the thumb or toe, the first toe, great toe. So on this, towards this side. Okay, this is the JD meridian. Correct. So, and it goes to the dorsum of the foot. From here, it goes to the dorsum of the foot. Do you know
So
which
does it not
meridian?
interact with the liver meridian there?
Which one?
So this meridian, will it not intersect the liver meridian as per TCM?
No. So see, liver meridian is actually begins from the first toe, means great toe, on the this fibular side, is towards the little toe side. It starts from that side, but this begins opposite to the which meridian? Stomach. Correct. Stomach meridian begins from the second toe, but it's on the fibular side, opposite lateral aspect of that bone. But this is opposite to the stomach meridian. Correct. It has a 7 points. It's a bilateral, means on both the legs. Then specification: joints and articular degeneration vessel treats the degeneration of the various joints in the human body. Any type of degenerative changes in any joint in the human body, it can be treatable by this JD meridian. Okay. Joint of the upper and lower extremities of the pelvic girdle, vertebrae of the spine, then shoulder girdle, shoulder joint, atlas joint. Atlas axis you might be knowing, the first and the second vertebra in the C1, C2 cervical, that is atlas and axis. Then temporomandibular joint, this one, temporomandibular joint. This mandible is attached to this temporomandibular joint. This one. When we do like this, so it is, you can feel the joint here. It's a temporomandibular joint. Then jaw joints, joints of the occipital head, joints of the atlantoaxial joints are all there. Then this meridian also treats synovial membranes of all joints. All joints are having synovial membranes. So synovial fluid is there inside the joint. That's because of the lubrication. Lubrication happens because of this synovial fluid, and the joint movement are very smooth because of this. When this when the synovial fluid of the joints get dried up and the joints become stiff, not shift, stiff. Stiffness of joints happen. This meridian treats the allergic irritation of the joints. You know allergic irritation of the joints or toxic irritation of the joints? Toxic irritation of the joint means, do you know the gout? Gout disease, gout.
Yes.
Yeah. In gout, what happens now? In gout,
Uric
this,
acid.
Uric acid crystals
correct. Uric acid
get accumulated in the toe.
is deposited inside the joint space, and because of that, this toxic, because that is the toxic, it acts as a toxin. So toxic irritation or allergic irritations of the joint. Then this meridian treats rheumatism of the joint. Okay. So come to the next page, 58 number. This meridian has one control measurement point, that is JD1B. It's a CMP for all the joints, including spine also. Then it is given joint is a junction of the two bony ends, and what is the synovial fluid? It's enclosed within a specialized membrane known as the synovial membrane, which is a top strong, and its inner surface is a secretory by nature. It continuously secretes a fluid known as the synovial fluid, which acts as a lubricant, provides a nourishment to the kissing surfaces of the two bones. Correct? We have seen this already. Now, what is degenerative arthritis, osteoarthritis? It's common men and women later part of the life. So as the age advances, this happens in everybody, in every joint also. Somebody may feel ankle joint, if heavy weight is there, obese person, generally knee joint and ankle joint is mostly affected. Then gradually is onset, and then degenerative condition of cartilage and bone happens. No constitutional disturbance is there. There is no local inflammation. It is a muscular atrophy only from disease. Okay. So we will see the point-wise locations and indications of this JD meridian on page number 59. Okay. This JD1 is a measurement point for degeneration of joints and arteries. Okay, it can be used along with stomach 45 number point. Stomach 45 is just opposite to that. No? JD1. Okay. This also can be sedated. You can set the ST45 as well as the JD1 for any joint degeneration.
To be sedate or tone? Something is degenerating, so I should like to tone it so that it becomes healthy.
Yeah, that was my question also to my teacher when I was learning. But see, if you will study the pathological changes, see if some pathology means infective pathology, even in infection, what we do generally, infection causes some harmful effects on the organs. So what we do, we sedate because the energy ultimately is increased in that particular organ due to infection. So pathological changes, that means increased in energy in that particular area. So we have to sedate the energy. So in degeneration, the same thing is happening. It's not it is a pathology, but it's a natural pathology. It's not due to some infective conditions, but degeneration happens as the age advances. So as the age advances, that particular area, when it degenerates, when the excessive energy, see, degeneration means the simple definition of degeneration. This is my shirt. If I'm using this shirt more times, it will become degenerate. Means I have used that shirt more and more time. Means any organ of the body, suppose this finger I am using more times. So if you are using this finger more and more time, means what? You are using your energy. Excessive energy can be used by this organ, by this movement. So this becomes degenerate. Means after certain limit, it degenerates. That means excessive use of energy happens by this organ, this finger. That's why it's degenerates. Means in Hindi we can see that say that कि मैंने बहुत यूज किया इसलिए ये अभी ढीला हो गया, degenerated हो गया. That means we have used that part of the body more and more time or frequently. That's why it becomes degenerate. So degeneration happens because of the excessive use of energy, and that's why it's degenerated. So energy is excess in that particular organ. So we have to sedate that so that it will recover the phase of the degeneration.
What I understood is because we're using something in excess and because more energy is needed for that. And that excess energy is causing it to go down in efficiency and degenerating it. And therefore, I need to bring down that energy so that it helps recuperate. Is that right?
Correct. Perfect. Perfect. Then joints of the lower extremities, pelvic girdle, pelvis girdle, then sacroiliac joint, SI joint. You might be knowing that SI joint, where ilium part of the hip bone and the sacral part of the sacrum is they are joint with each other. That is joint of hip bone, ilium, and sacrum. Sacroiliac joint. Joints of lumbar vertebrae. This can be treated with this JD1. Then JD1-1, it's MP for focal toxic irritation of the joint. See now, focal toxic irritation is nothing but the gout. It's increase of the uric acid level in the gout. So this is a focal toxic irritation of the joint. JD1-1. Even the best part is this gout or the uric acid deposition is generally happens in this great toe or the first toe on the outer inner aspect of that. It's a second joint. Generally happens here. Gout's main symptom is this. The legs, this finger of first toe is paining. Gout generally happens there, or these fingers also, means index finger or anywhere. Generally, small joints are more prone to accumulate this uric acid crystals. And then slowly, if it is untreatable, means untreated, then it goes to the bigger joints also. Then JD1A. This is JD1 is MP for allergic irritation of the joints. Then JD1B. It's a CMP for all joints, including joints in the spinal vertebrae also. Treatment on this point. What?
Sorry, one more question related to the gout.
Yeah.
So this uric acid irritation happens because of the deposit of those crystals. So does it also mean somewhere the person's kidney or the...
Wait a minute. Actually, your voice is not properly audible to me. I don't know why, but can you please...
Is it clear now?
Yeah.
Yeah. So I was asking if this gout example, which we are just discussing, is it because one would also have some problem in their kidney or in the urinary bladder, which is resulting in these uric acid crystal deposits in the big toe?
No. Actually, it's one of the content of the uric acid is one of the content of the blood also. No? Means in blood, but somewhere pathology is there that uric acid is deposited. Means it's not properly filtrated out from the kidney. So might be kidney function is, but I have seen a lot of patients kidney function is proper, but because they have the lot of intake of the uric acid contents. Means what happens? Uric acid is the ultimate product of this also metabolism of the carbohydrates.
Excess proteins too, sir.
So is there a possibility that people who have uric acid will also have cholesterol?
So am I audible?
So is there a possibility that people who have uric acid will, chances are that they will have cholesterol also?
No, it's not like that. Means it is not compulsory. And uric acid are not having such relation with each other. Uric acid is the ultimate product of carbohydrate metabolism, and the persons who are morely using this carbohydrate diet or like a non-vegetarian diet, means where the flesh is more, non-vegetarian diet, chicken
Excess
or
protein,
mutton,
sir.
like that.
Excess protein.
What? Yeah, excess protein.
Excess proteins.
Correct. Excessive protein intake. That also may lead to uric acid accumulation in the joints. And because of the heavy load of that uric acid, kidney cannot filter. It has certain limit. Kidney has certain limit. Out of that limit, kidney is not able to filter that, and it is not going out of the body through urine. So it is accumulated in the joint spaces. That is the pathology behind this gout. Okay. So next is JD1B, the CMP for all joints, including joints of the spinal vertebrae. Yes, JD1C, MP for synovial membranes of all joints. Now we are seeing in the old age what happens generally. Drying of this synovial fluid happens, and due to that, this cracking sound in the joint is coming. Cracking sound, sometimes in the knee joints, or sometimes in the ankle or fingers also. This drying of the synovial fluid may cause cracking sound in the joints. So in such cases, we can use this JD1C, JD1C pointer. Then JD2, this is MP for joints and articular degeneration. Joints of shoulder girdle and arms, lower cervical and thoracic vertebral joints, C4 to C7 and T1 to T12. Joints of shoulder, joints of upper extremities, etc. Okay. Now JD3, this is the third point. See, where is it located? Third point, JD3. It's a metatarsal, the second metatarsal. Correct? You know the bone's name, metatarsal. These are the metacarpals on the hand, in the hand, metacarpals, and these are the metatarsals. So the second metatarsal, the head, the concave part of the head, just beneath the head of that part. So MP for joints and articular degeneration in C1 atlas and C2 axis joint. Then temporomandibular joint, upper cervical vertebral joint C1 to C4. Then joints of atlanto-occipital, again that means first means C1 to occiput, upper side of the skull. Then jaw joint. Now you can use this point along with that also. See, TW23 and ST2 for problems of the upper jaw joint and lower jaw joint. JD3 along with TW23. Where is the exact location of TW23? Do you know? Triple warmer 23. I think it's the last point of triple warmer meridian. So triple warmer meridian goes
Is near
17.
Here, sir, in front of the ear. Yes.
Correct. It's a 17, 18, 19, 20. 20 at the top of the ear, then 21 in front of the ear, 22 and 23 where it ends. Just the lateral end of natural eyebrow. This is the lateral end of the natural eyebrow. Correct? Lateral aspect or the lateral end of the natural eyebrow where it ends, the TW23. That point along with this JD3 can be used to treat upper jaw joint, upper jaw.
So this will
upside.
also be used
And
for jaw locks.
yes, correct. Lock
Yeah.
jaw. And the lower jaw joint, you can treat ST2. Where is the location of ST2?
It's below the eyes.
Below the eye.
Below the eyes.
Correct. Below the eyes, but where? Below the eyes is
In the
here,
center of
here, here.
center portion, eyeball center portion.
Yeah.
Below there.
Yeah. We have to use the reference as a nose. See, nose ends here. Nose ends here. Where the nose ends, you can have the horizontal line from the nose end, the lateral end of this. Yeah, correct. So there, and the middle part, center part of the eye, that is the first point, ST1, correct? ST1 is the center part of the eye. Draw a vertical line from that. When this and this line joins with each other, that is the ST3. Above that means the half of the nose, middle of the nose, you can draw a second horizontal where that connects to the vertical line, that is ST2, and the first is ST1 here, and the ST4 is the lateral aspect of the lip, where the both the lips, upper and the lower lips joints there, the angle of the mouth there, 0.5 kun from the angle of the mouth, that is ST4. So this is a straight line from ST4, ST3, ST2, and ST1. This is the line. Exact means it, but in case of acupuncture, I am doing acupuncture actually since last 20 years. So to insert the exact needle at the exact place, I have to know the exact location of the point. That's why we are using on the hand only. ST2, ST1, ST3, everything is here. We are using that beyond magnets. So on the body, only some spaces we have to know, some locations. There is not in a deep. Okay, so
So this
this
is
ends.
where is this? So which page and which treatise? Because I'm not able to find it.
What?
So which page of the which treatise? Because I'm not able to find this JD
It
Meridian.
is
page number 60.
Yeah, treatise 3, page number 60.
Yeah, I am on treatise 3. Okay, so let me check.
Page number 60 and 61. Now we have finished this JD Meridian also. Okay. Now we'll go to next chapter, 9th chapter, fibroid and interstitial degeneration vessel, 50 meridian. In short, it is called as a 50 meridian. Okay. This meridian starts from the tibial side, again tibial side of the nail of the third toe up to the dorsum of the foot. See, this is the third toe. Tibial side means towards the great toe, towards the thumb. This great toe. And this is the third toe, means middle toe on this side, on its this aspect. Okay. So you can see in the diagram also on page number 65. So do you know on this finger, this middle toe, any meridian, the body meridians, any meridian from main 14 meridians is going from this side? No, there is no meridian present on this middle toe. Okay. So the number of points, it has 5 number of points, 5 points. It's a bilateral meridian. It treats fibroid degeneration. That's why it is called as a 50 meridian. Fibroid degeneration, 50. Fibrosis means due to increased fibers. Then cirrhosis means increased stenosis produced by chronic inflammations without compressions, strictures. Then benign tumors of the connective and interstitial tissue. Then fibromas of the skin and mucous membranes like polyps and papillomas. Then individual fibrosis. Fibrosis anywhere means increased fibers, stiffness. Any degeneration in the connective tissue pertaining to interspaces of the tissue can be treated by this meridian. And the third is this meridian has 2 control measurement points. One CMP regulates fibroids of the whole body, and the other one regulates the fibroids of mucous membranes of the whole body. Okay, these 2 are the best points for the treatment of fibroids of the body. What is fibroid degeneration? Fibroid or the fibroma is an overgrowth of connective tissue present in all body structures between 2 cells. Then what is interstitial degeneration? Interstitial means a space or gap in a tissue or organ. This tissue may remain vacant or be filled with a tissue other than the tissue itself or the organ tissue. This is called the interstitial. Interstitial spaces. Okay, we will see the exact point-wise locations and indications. Anyway, generally we have seen, commonly we are seeing the patients of uterine fibroids or ovarian fibroids or some abdominal organs fibroids, any fibroids.
So will cyst and fibroid be the same, or will there be a difference?
It is almost the same, but cyst is having some particular fluid in that. But in case of fibroid, no fluid is present. Cyst is the same, the top part, but inside it there is some liquid or fluid or semi-solid material. But in case of fibroid, there is no fluid present as such. There is just increase in number of the fibrous tissues, connective tissues. That's why it's a very tough structure, fibroids.
And so would a chocolate cyst be equivalent to a fibroid? Because even the chocolate cyst has
No,
become very tough.
Yeah, chocolate cyst is also kind of a cyst only. It has a liquid inside, but it's more tougher than the normal cyst. But it is not like a fibroid, but its color changed because of the overuse of that part. Means the the pathology inside the cells. That's why the change in the color happens. It is look like a chocolate. That's why it is called a chocolate cyst.
Yeah. And so would the treatment be different for both, or would it be same?
No, cyst can be treated by this also, but this 50 meridian is specifically used for fibroids, where the increasing numbers of the epithelial or connective tissue or fibrous tissue.
Okay, fine.
Fibers.
Fine. Yeah.
So cyst can be treated by the different, again, the different meridians are there for treating cysts. Yes, you can use this meridian also, no problem. But the thing is, more the harder is the nodule or the tumor, that is the fibroid. That's why this fibroid meridian can be used, 50 meridian can be used for that. Fibroids. So
Polycystic ovaries can be treated with this. Polycystic ovaries.
yeah, polycystic ovary means what? The multiple cysts are there in the ovary. That's why these are the cysts again. No? You can treat with this, but it is specifically for fibroids, not cyst. If the cysts are very older, means very old cysts are there, and they become in USG sonography, you can see that if it is tougher than the normal cyst, means inside fluid is not present in that cyst, and it becomes tougher like a fibroid, then that kind of a cyst can be treatable with this also. So 51 MP for fibroid degeneration of the organs of the abdomen and minor pelvis. It includes external urogenital organs. See, external urogenital organs, veins of the lower extremities, fibroma of the liver. Again, they have divided the fibromas of the liver. Reasons of the fibroma: the carbon dioxide intoxication, then acute severe anemia due to acute insufficiency of the right ventricle of the heart. These are some causes due to which this fibroma of the liver happens. Then fibrosis of the pancreas, nephrocirrhosis, fibroma of the spleen, stenosis of the pylorus, stricture of the urethra, polyposis of the intestines, then papillomas of the urinary tract, cyst of the ovaries. See, the cyst of the ovaries is mentioned here. So polycystic ovaries can be treated with this 51. Cyst in the kidney, cyst of the liver, clavofibromas, these can be treated. Then 51B. Second point is 51B. See, this first point is located in the first digit, then the second middle digit, second point 51B, and the third digit 51C. It includes benign fibroid tumors, adenomas, angiomas, fibromas, fibroadenomas, lymphangiomas. For any fibroid in the body, treat this point. Any kind of fibroid in the body, you can just treat this 51B. Then 51C, CMP2 for fibroid degeneration of the mucous membranes of the whole body. Anywhere, any mucous membrane. This mucous membrane are especially present in this mouth mucous membrane, nose mucous membrane, small intestine, large intestine, uterus, then anus. Mucous membranes are just the outer parts of that organs, where the opening is there. Treat this point. Polyps and benign papillomas. These are the cancerous growth sometimes. These nomas means cancerous growth. It may be benign, not proper cancer. It's not malignant. It's benign tumor. Then PIP-D2, MP for fibroid degeneration of organs of chest and neck, and mammy, breast. Breast can be treated here. This is also common nowadays. It's not so common, but in ladies, this mammy breast are having these fibroids or the cyst, multiple cysts in the breast. Now, treat stenosis of the esophagus, stenosis of the heart wall, fibroadenoma of the cyst of the mammy breast, then cyst of the thyroid gland is also treatable. Then PIP-D3, MP for fibroid degeneration of the organs of the head. Correct? PIP-D3. Is in the regions of mouth, nose, middle ear, and throat. The bones of the face and the skull. Okay, this is diagnosis part. Polyp of the knee, all the papillomas and polyps of the ear, nose, etc. Okay, so this is a 5th meridian, fibroid degeneration. Now we will go to the next chapter 10, page number 68, skin degeneration vessel or skin degeneration meridian. Now this is very useful and you all can love this skin degeneration because it is a very useful for cosmetic purpose. For any skin problems on the face, it is means very useful for any skin problems, cosmetic purpose. Ladies can love this skin degeneration vessel. Okay, its a location is starts from the fibular side, that is outer side of the nail of the third toe. Now third toe is having both these meridian, this on the medial aspect or the tibial side, this 5D, and on the same toe, the outer aspect or the fibular side, this SK meridian. Okay. You can see its diagram on 71, page number 71. Means this third, the middle toe is having both sides. On the great toe side, this fibroid
So
degeneration.
if you can
The
cover also what
opposite
are the
side.
kind of questions that will be asked for the exams after each chapter, so that we are aware that, okay, these are the kind of questions that can be asked.
Yes, sure. In the theoretical part, generally they ask you multiple choice questions. So in that, they have morely you have to know all the CMPs of all the meridians, 8 meridians. CMP, specifically CMP, then sometimes MP, measurement points. MP and CMP, these are the prominent questions. CMP is very useful. So it's a very, in questions, CMP is generally asked. And sometimes they ask the locations of the meridian, where it is located. So you have to correctly know, exactly know where is the exact location. On the medial aspect, means in hand radial aspect or ulnar aspect of that particular finger. And in the case of toes, this is outer side or inner side, like fibular side or tibial side. Then they might ask you about suppose different questions like that 3 parts. Just now we have revised that. Now, first point should be used for the lower part of the body, the second for the upper part of the body, and third for the head part. So again, they will ask you the tricky questions. So somebody is having the problem of skin in the leg. So which point is used? So you have to use the first point of the skin meridian, like that. In any meridian, you can ask. Somebody is having problem of the head. Some skin problem is at the head. So which point can be used? So general questions like this. So you have to know the principles, the fundamentals of this Electro Acupuncture, and the locations and the CMPs. It is general. Now specification. Skin degeneration vessel treats the skin of the whole body. Then it also treats the scar on the skin. Location of the scar and the meridian on whole pathway. The scar has appeared. First moisten the scar and the treat. Yeah, it is given that you just have to moisten the scar. Where there is a scar means what? After any injury or any rash, the chronic effect of the rash, it becomes scar tissue. So scar should be first moistened and then treat. Moisten means what? You have to apply any jelly or anything like we are using that in a winter season. So many creams and all that. Just moisten that and then use. Then surgical scars can be treated by a simple massage on the whole skin meridian, or else apply fenugreek methi strip on the whole skin meridian. Okay. Surgical scars.
So these will be scars through stitches also, or even if you've got burnt because of picking up something warm or hot, that scars also will be treated through this.
Yes, yes, yes.
So
But
then,
it will take.
do we have to look at the location? Like if there's a scar, say on the elbow, then it comes in the center part, and therefore the second point will be used. And if the scar is on the leg, then it will be the first point. Is that how we treat it?
Yeah, that's why it is mentioned here. This is a specific note. The third point you can see. Surgical scars or any scar, the big scar, can be treated by a simple massage on the whole skin meridian. Means all the points on the skin meridian. Correct? Or else apply fenugreek methi strip on the whole skin meridian. So each and every point of the skin meridian means all 7 points should be treated. If scar is big or scar is surgical, then okay. Means all the 7 points can be treated. Then treat allergy meridian along with skin meridian to find out whether an existing allergy is caused by allergies due to inside or the contact outside. Treatment of scar. See, it is given specifically, scar treatment. SK1A indicates a scar foci, focus of disturbance. Then SK1 treats the scar in the lower part of the body and the lower extremities. And SK2 treats the scar in the upper part of the body, including arms and hands, neck and chest and upper back. And SK3 treats the scars in the head and the skull, including face. Then skin degeneration includes changes in the color of the skin, stains, marks, pokes, then heat rashes and other types of diseases of the skin, lines on the skin, wrinkles, disease of the skin hair, excessive dryness or wetness of decay of the skin and scars. Okay. Now we will come to the exact points and location and the indication. This is SK1
So
is the MP for. Yeah.
So should it be sedate or tone?
Yeah, if we have to sedate all the points on, because scar or anything, any skin allergy or any skin problem, it is because of the excess energy, rashes on the skin. It is excess part of the diagnosis, excess energy. So we have to sedate again. Itching is there, more itching on the skin is there. Itching is the yang, means excess. So we have to sedate again.
Anything using colors? Can we do it with colors also along with seeds or magnets?
What happened?
No,
What you are asking?
No, can we use colors also to sedate?
Yeah, definitely. You can use
So
black color.
Black. No?
Black color. Black color is best for sedation. Any joint, any point sedation, any meridian sedation, we have to use black color.
So where they mentioned that if there's a surgical scar and if the whole of the skin meridian needs to either we massage it or we give methi patti, there we can also use a whole meridian can be colored with the black color. That should also do.
Color. Yes, definitely.
Okay.
MP for skin degeneration, lower part of the body, abdomen, sits, that is hips, and the skin of the legs. This is SK1. SK1-1, lymph vessel of the skin. This point is related to the lymph vessel of the skin. Treat this point for the abscess or pox, etc. Abscess. Even anywhere in the body, if there is abscess, boils, abscesses, you can use this. In abscess also, we have to sedate. Then SK1-2, MP for allergic reaction of the skin. Treat this point for any type of allergy of the skin on the body. Along with that, allergy meridian. Ready. Then SK1-3, CMP for whole of the skin. Then treat this point for anywhere and any type of skin allergy on the body. Then SK1A, MP for scars of the skin. This is MP for wound marks, scars, and marks of surgical operation on the skin. Treatment on this point can cure stretch marks of the abdomen and pelvis after delivering the baby. See, after delivery, there are so many marks on the abdomen. No? Generally, in ladies, it happens. So you can treat those also, but it will take longer time. Means you have to put this color or something like magnets for at least for 4 to 6 months. Then the scar will go. So wonderful treatment. In sometimes ladies are having these scars, white mark scars are there. White means skin is just loose skin, smooth skin is there, very sensitive. So thin skin is there. So you can tone in such cases. Tone this point. Means if it is on abdomen, so this SK1 should be toned. If it is thin, but if it is dark and thick, no sensation. Generally, what happens in surgical cases, they are taking this with the blade, with the help of a blade, surgical blade, they cut that, and it becomes in a form of a wound, and then they stitch. They take the stitch there, so it becomes hard and thick skin. But in some normal cases, means if it is normal delivery and stretch marks are there, that is a thin stretch marks. Just because of the fetus inside, the abdomen gets stretched, and that stretch marks are there. They are the thin. Skin is very thin. So in such cases, you can tone this. Okay. Now come to the page number 72. SK2, skin of upper part of body. Skin of arms, hands, neck, chest, upper back. SK3, skin of head and skull, including hair. Also hair problem. Skin of face. Now the spatial mode. Come to the spatial mode. Treat SK1, SK1-1, SK1-3, SK1-A for the stretch marks on abdomen, pelvis, and thighs post-delivery. Along with treat SP4 and PN4. This is spatial notes. It is given. Abdominal scars after delivery, post-delivery. We have to use these points. Along with that, SP4, spleen's 4 number point. Why spleen is used here? SP4.
Is the Leo
Spleen
connecting
holds,
point?
yes, spleen holds all the things. No? So loose wrinkles on skin, wrinkles on the skin of the body is also happens with the decrease of the energy in the spleen. Spleen's energy, spleen deficiency.
So
So
then we can use
this.
SP3 also, no, instead of SP4.
SP3, it is specifically used for carbohydrate metabolism. So where there is a diabetes cases or more glucose sugar levels of the blood, then we can use SP3. SP3 is also ion source point actually we can use, but SP4 is specifically mentioned in this book.
So,
Now,
but SP3 for diabetes, we shouldn't be using now because that will increase, in fact, the diabetes.
No, for diabetic patient,
SP9 we should be using for diabetes people, no?
No. SP3 is specific for carbohydrate metabolism, glucose, sugar metabolism. So if more sugar levels are there, we have to use sp3. Sp3 is very important point. Sp3 and pn3, this is mentioned here. Pn means pancreas 3, sp4 is spleen 4, and pn4 means pancreas 4.
Okay, sir.
Where is the pancreas meridian located?
So near the thumb side of the
No.
big toe side.
Of
No,
the
no,
right
no, no,
foot.
no.
On the right
Perfect.
foot.
Of the right foot.
Yeah. It is a spleen meridian only, but on the right foot, means the right side spleen meridian is called as the pancreas meridian. Because in the body, pancreas is located on the right side of the spleen, and spleen is located at the left side. That's why left leg means left leg is having spleen meridian and right leg is having pancreas meridian. So PN4 and SP4 are specifically used for this. Again, it is given diagnosis and treatment should be given on the both the meridian, skin degeneration vessel and allergy or vascular degeneration vessel. SK1-2 is the diagnosis point for all the allergic changes on the skin. The part where allergy occurs on the body, treat related point of that part on the skin meridian and allergy meridian, and also add AD1A, allergic irritation of autonomic nervous system, and AD1B, CMP for allergy processes throughout the body. Yeah, it is again given in vascular degeneration cases. Okay, you can read it out. Now we will come to the page number 73, chapter number 11, fat degeneration vessel, fat D meridian. It is also you like this meridian also. It's very useful in obesity. It is also cosmetic purpose. Fat D meridian. So its location is this meridian starts from tibial side of the nail of the fourth toe of foot, goes to the of the foot, tibial side again, on this side, tibia, tibial side, on this side. Okay, fat tissue meridian. Then it has a 4 number of points, bilateral. Specification: fat degeneration vessel treats fatty infiltration of any sort in any organ, such as a fatty liver, fatty heart, fatty jawbone, fatty brain, everything. Where there is a much accumulation of the fat in the body because of the indigestion of the fat. Okay. This meridian also treats fatty infiltration of any sort into any tissue system, like arteriosclerosis happens because of the fatty degeneration or the fat accumulation in the arteries. Then cerebral sclerosis, coronary vessels and sclerosis, then lipid necrosis, everything. In necrosis happens, that is called as a lipid necrosis. Necrosis. What is fat degeneration? Every cell contains variable amount of carbohydrate, protein, and fat. At times, fat may be accumulated more than its capacity because of a local breakdown of the mitochondrial metabolism of the fat produced by disruption. It may be caused by some injurious influences. Then it commonly seen in liver, kidney, and myocardium. Then normally caused by poisons, including organic poisons or bacterial and inorganic poisons, which bacterial and anoxia, and anemia caused by hypoxia or stagnated hypoxia or anemic hypoxia. Where there is a lack of oxygen, and due to which this fat metabolism gets impacted. That's why this fatty degeneration happens. Okay. Now, special notes: in fatty degeneration, the following pathological changes may exist. Okay, it's a pathology given there. What happens there? Cardiac muscle caused by phosphoric and arsenic intoxication, auto-intoxication, diphtheria, anemic infarcts, occlusion of the coronary arteries. All above instances of fatty degeneration may be diagnosed with only small drop of M. This is the diagnosis part. Actually, we don't have to go in that much deeper. We have to use these meridians, all the points, for fatty degeneration anywhere in the body. Then what is meant by lipomatosis and hyalinosis? That is also pathological part. Lipoidosis means a disorder in the metabolism of the neutral fats and lipids with the deposits in intima, media, and means these are the three layers of any organs coverings. Precise fat soluble vitamins. See, fat soluble vitamins are vitamin A, D, E, K. This all the four vitamins are fat soluble, and all other vitamins are water soluble. So these fat soluble vitamins can be prescribed in such cases along with the treatment of this fatty meridian, vitamin A, D, E, K. Okay. Then we will see the point-weight location and indications on page number 76. Head degeneration vessel or head meridian. It's okay, na? This is the only theoretical part. You can read it out. It's a very means it's not useful for us. It's complicated, little bit complicated part. It's indication of pathology inside the liver. Three types of different fatty degeneration happens. That is there given there. Now you might be knowing about the USG reports, sonography or this USG reports, ultrasonography reports. In that, they have commonly mentioned about the fatty degeneration. Generally after 35 or 40 years of age, everybody is having this fatty infiltration or fatty degeneration or fatty infiltration of the liver. Because if somebody is having proper diet, proper regulation of regulated habits, like proper exercises, morning walk, yoga, pranayama, or breathing exercise, or something like that, then in that cases it might not be happen. But in day-to-day practice, I am practicing since last 20 years. I have seen almost every patient who comes with the USG reports, and if his age is after 40, if he is coming after 40 for any complaint, any other complaint. So it is normally mentioned that fatty infiltration, first grade fatty infiltration or degeneration, second grade fatty infiltration, or third grade fatty infiltration. So these are the three different types of fatty infiltration in the liver. Why liver? Generally, liver is the first organ in which all these metabolisms and all that is going on. All protein, fats, carbohydrates, everything is just finely metabolized in the liver. So liver is more prone to infiltrate or degenerate of anything. Means, any acid, any protein, amino acids, or carbohydrates, uric acid, ultimate, and fats. So it's very common. First grade fatty infiltration of the liver. It is very commonly seen in after 40 age in so many patients. So this is just a theoretical part. We can use the various reports while treating the patient. If it is given there first grade or second grade fatty infiltration, third grade, you can use this meridians points for treatment. Okay, so we will go to this very short meridian again. Fat D1, fatty degeneration in organs and vessels of abdomen, small pelvis, lower extremities. It includes fatty liver. See, it is given fatty liver, lipoid nephrosis. Okay, then 51B, second point on the second digit. It's second phalange of the fourth toe, the upper end. Fatty one is CMP, fatty degeneration of organs and vessels of the body, whole body. Anywhere in the body, if there is a degeneration, fatty degeneration of any organ or any vessel, fatty degeneration of the vessel happens in even in vessels of heart.
So this is D, 1D or 1A. It should be 1A, right?
Yeah, actually,
Oh.
what happened? Na? This was my question also. This should be in a series actually. Na? So our mind goes on that side. Ki after one, there should be two or one A, then one B. This is the series actually. Na? But I have asked the same question. But it is like that only. Dr. Voll has given these names. It is here. No one A is present. Why? Why? One reason he has given me that time. Actually, you can see the location of this 1D. It is on the first digit upper corner, correct? So the first digit has a lower corner. It is empty. Again, the second digit upper corner is empty. There is no point. And this is the second digit lower corner, lower part. That's why it's a 1B. He has given the 1B. Some teachers have given me such reasons. I have the same question actually. Okay, this is second 1B. Then the third point, D2, fatty degeneration in organs and vessels of chest. It includes fatty degeneration of heart, fatty degeneration of heart muscles, means cardiac muscles. Then coronary vessels. See, coronary vessels fatty degeneration also happen. Means if somebody is having a report of this 2D echo, you might be knowing this 2D cardiac echo. This 2D echo report is there. It is especially useful for to see the function of the heart, cardiac function, whether the all the four chambers of the heart, specifically left ventricle function is diagnosed by this 2D echo report. 2D echo is one of the tests which is generally useful to see the function of the left ventricle specifically. So whether left ventricle is able to contract properly, means its muscles having the strength, proper strength, and they are contracting properly so that the blood flow throughout the body is proper. So in the this is the routine checkup in patients of hypertension or after 40. Generally, this is the routine checkup. 2D echo in every year, once in a year you have to do this 2D echo report. Or the patients of hypertension or the patients of this hypercholesterolemia, increased levels of cholesterol. There also you have to use this. Cholesterol is nothing but the fat again. No? Means you have to use hypercholesterolemia patient, you have to use this fatty meridian.
So we can even use this for blockage of arteries in the heart.
Yeah, correct. So in 2D echo or in angiography,
If angiography.
Yeah, it's a third test. First is the ECG to see the function, ECG, electrocardiogram. Second step, if electrocardiogram is not able to find out the exact problem in the heart, then the second stage is 2D echo, means the sonography of the heart. It's nothing but the ultrasonography of the heart. Then the third stage is angiography. Means in angiograph, angio means in cardiac vessels, these coronary vessels are specifically seen in that angiograph. So whether the block is how much percentage block is there, means 10%, 30%, 50%, or 80%, like that. If blockages of the coronary vessels can also be treated with the help of this meridian.
So we can use the CMP and the FAT D2.
Correct. Very good. Excellent protocol.
Thank you, sir.
So you have to use CMP in every case, along with that, according to the body parts. The second point.
Sir, does this reduce the blockage genuinely?
Now, what? Yeah, it reduces the blockage, but the patient nowadays, they don't have that much patience.
It will take a long time.
They cannot use. Yeah, it will take a long time. Even though it is taking long time, we have to use this, because what happens in the case of cardiac, any insufficiency of a cardiac function, anything happens in the cardiac part, we have to be patient and treat with these natural methods. don't go for the allopathic mode. But nowadays what happens now, everybody don't have patience. They have fear in their mind that it might be death might have come. So what's the use of these therapies, na? So people are generally going to the allopathic doctors for immediate recovery, immediate treatment. They are using this allopathic mode, because in case of heart, no, there is a naturally God has given this gift to us. Any
Full
another
action.
vessel developed, yeah. So even though there is a blockages, another combination of two vessels happen naturally in the body, and the blood flow of the heart is never stopped. It goes on, but the patient must have patience in his mind. He should be
Patient will be
quiet,
patient.
doing proper exercise, taking proper food. Then only it happens. Otherwise, everybody, not even you and me also, if once we get the report of angiograph, and if it is saying three vessels blockage in 80%, 70%, so there is naturally fear in the mind, no?
Patient. Yes.
So that's why nobody is going for this therapy. But we have to use this point as a preventive measures. Means if we are having the history of hypertension since last 5-6 years, or anybody is having 5-6 years, so he can use these points, na, as a preventive measures. So further he will not develop the vessel blockages, coronary blockages. So for prevention, it is best. Now, for degeneration of the arteries, then degeneration of the upper extremities, degeneration of the aorta and all that. Then come to the page number 78, that is fat D3. Fatty degeneration in organs and vessels of skull. It includes cerebral sclerosis, then cerebromalacia. In this, cerebrum becomes very tender. Then fatty degeneration of the jawbone, fatty degeneration of brain vessels. Treatment protocols for fatty liver, fatty heart, and fatty brain. Now they have added PN4 in this and SI1A. While studying the fourth, treatise 4, we will come across this point, SI1A, PN4, like that. I don't know, in your syllabus, semester 3, there is treatise 4 also is included, na? So this is your 6th class now. When that syllabus is covered, then who will cover that? I don't know. Means how your these classes are going on. This is the 6th and the last class almost. Means 4 classes are remain, but still this first book only treatise 3rd is being covered. What about treatise 4? It's vast. All the 14 meridians are there, according to Dr. Voll. So let us see how Sansthan will get the orders, and we will see that. Okay, this fatty brain and all that. You can read it out. PN4 SI1A, fat D1 for fatty liver, and fat D1B. Then fat D2 for fatty heart. Then fat D3 is added in fatty brain. Okay, then stenosis of the heart walls. FIB D2, D2A, and D1A. FIB D2, FIB D2A, and FIB D1A. Add for pulmonary stenosis H9R. Yeah, we will come across these points also. This is heart 9 right side, heart 9 left side, heart 8 point H8 left side, and H8 right side. This is for 4 types of walls are there, na, in the heart. So pulmonary walls are there, pulmonary stenosis, then aortic wall are there, mitral wall, and tricuspid wall. All the 4 walls of the heart can be treated by these H8 and H9 points on the right and left side. We will come across these points while we will study the next treatise 4.
So then
Sir,
if the heart is becoming bigger, like if there is a heart megaly, then this also points can be used.
In which cases?
Heart megaly, like when the size of the heart increases.
Cardiomegaly.
Yeah, can we use this?
Yeah, it is also can be used, because but the cardiomegaly's reason should be find out. Means whether the generally cardiomegaly happens because of the excess mass of the muscle. Means muscle of the cardiac muscles are increased in size. It's a hypertrophy of the muscles. That's why cardiomegaly happens. Generally in the asthmatic patients or in the hypertensive patient it happens. Asthmatic patient it's very common cardiomegaly. So in such cases we can use, if it is because of the fatty infiltration in the muscles, then it is useful. Otherwise it's a hypertrophy of the muscles. We have to use
So if it is because of the
meridian
asthma,
proper.
like if it is because of the asthma, then should we treat the lungs
If
and
it is because of asthma, yes, correct. So we can use this also. Along with that, we have to use so many other points on the lung meridian, heart meridian, and spleen meridian, because spleen is taking care of the muscles, liver and spleen meridians. Muscles, tendons, these meridians are taking care of the things.
okay, sir.
So cardiomegaly can be treated with the various points on the various meridians. We have to use multiple meridians and multiple points on the meridians. We can
Sir,
add this in the treatment partner. This all the treatise 3 and 4, means treatise 3 specifically. This Dr. Voll's meridians, these 8 meridians on 4 on fingers and 4 on toes. These are specifically used for additional treatment along with the main meridian points. For additional treatment can use only with the help of these points. Sometimes means I have not seen generally in my practice also. We have to use this meridian as a additional points for treatment. Exclusively with these points, some diseases are curable, but it may take a little longer time.
Sir, here in
what is
stenosis of heart wall, fibroid 2, D2A, here the D is referred for what? Which meridian? D2A, D1A?
this meridian only, fat D meridian. They have
But we don't have 2A and 1A. Okay, we have to create it in between.
yeah, it's the empty spaces are given there, na?
Okay.
No. In which case you are asking me? The last part of this 78 page number.
Stenosis of heart wall.
Yeah,
78.
This is 50 meridian.
Okay.
It's not fat. 50 meridian.
Fibroid degeneration. Okay.
Yeah, fibroid degeneration. 50. We have seen just now, na? Fibroid degeneration. It's a 50 meridian. 52, 52A, and 51A. So in stenosis and this cardiomegaly, we can use this fibroid degeneration, 50 meridian, because this is the problem of muscles. Okay, I think we have to stop here. In next class, we will discuss something, and we will see this also a little bit protocol for the treatment of eye disorder. In a short only, we will see later in the later class, next class. I think.
Sir,
Yes,
one last
Sushma
question.
Oza.
Sir, one last question.
Yeah.
Which magnets are best for this treatment, FD treatment?
Yeah, Biol magnets only. We are using in Sansthan, we are using Biol magnets only.
Biol magnets.
Star magnets, if you are not confirmed with the exact diagnosis, whether to sedate or whether to tonify, you have to use the star magnets. Star magnets are very safe to use. Okay. And along with that, if possible, you can use methi patti, methi spheroids. These are very safe to use. If you are confirmed, if it is excess, you have to sedate that point, then you have to use Biol magnets. Biol magnets are very useful.
Okay, sir. Thank you, sir. Thank you.
Okay, thank you. Thank you very much, everybody. Bye. Yes, ma'am. Sushma Oza, ma'am. You can continue your class.